welcome. You're watching Inspire India here on Mirror Now. I am Afrida Rahman Ali. Yes, there is doom and gloom around, but let's not forget that there are beacons of hope around us as well, who's taken up humanitarian work to step up and help out the needy. And this is, of course, something that is a huge service to a country like ours. Remember, if it was not for these good Samaritans, if it was not for those NGOs, foundations, the civil society partnerships and community partnerships that have come together to step up, we would not have been able to recover from the intensity of the second wave. If the numbers have come down today, it's not just government programs or efforts, it's also the civil society citizens who are doing their bit. So on Inspire India, we feature such individuals who have taken the courage and the determination to help those around them. Let me introduce Hyder Ali, who's joining us from Chennai. Hyder Ali is actually a zoology professor who is also doing or involved in humanitarian aid. He started this only this year in May 2021, and we will talk to Hyder Ali to find out how it's going and what are the challenges he's facing on ground in Chennai as he reaches out to the poor to provide them their 2 square meals. Welcome, Hyder Ali. Thank you so much for joining us on the program. Next, we move to Ashish Ranjan from Bengaluru. He is actually a professional who works in the digital media industry. But then now Ashish has decided, in fact, it's only been a week that Ashish has launched this humanitarian aid program with, in collaboration with his family and his team members. He's working to help out the poor in the rural areas around Bengaluru. Ashish is busy and engaged with distributing meals, reaching out to the poor on a daily basis. Ashish, welcome. Thanks for joining us on Inspire India.
Thanks for having
So I'm going to first start with our guest from Chennai, Hyder Ali. I want to begin with you and ask you to tell us what is the kind of work you are doing at the moment in Chennai. Which are the people really that you're catering to?
Actually, I am Dr. Hyder Ali, Deputy Warden, the New College Hostel. As a joint initiative of the management, principal, vice principal, faculty, retired staffs, non-teaching staff, alumni association, students, president and former, and with the cooperation of the police officers, we have been helping the poor and needy with the food packets and mineral water bottle. Since May 15th, initially we helped 15 poor and needy frontline workers, and gradually this help will extend to more than 1,000 poor people in the neighborhood area of Rayapeta every day. With the continuous support of the philanthropists, the educationalists, the charitable members, and the great alumni association headed by Janab Hasim Saab and Janab Ilyas Seth, that is secretary and correspondent of this great institution, the New College, and the treasurer, Janab Najibuddin Shah, is a treasurer of this great institution, and the noble-hearted peoples. We are jointly venture and helping the poor till today. And
right.
I'm once again thank that media people who come over to interview with me.
Yes, that's commendable. What you started with was 15 food packets. Today, you're able to distribute 1,000 food packets. That just goes to show that one can start small. That doesn't matter. But the idea is to have that intention to help, to believe that, yes, you can do your bit, however small, and it invariably ends up helping out a lot of people in the long run. Stay with us, Hyder Ali. Let me go across to Ashish now. Ashish Ranjan, you are working in and around Bengaluru, again helping out the poor and the needy. Now, one of the things that we are looking at very closely is that a number of people who have become jobless because of the pandemic. The daily wage earners, of course, worst affected. But with the lockdown, there's so many services that remain shut and people have to struggle to get their meals. Are you also looking into this area? What have been your experiences so far?
Ma'am, we started a week back, and Yes, that is true. Food has been one area, it's necessary for almost everyone. And in the rural areas, as you can see, there are not a lot of job opportunities right now. And as I told you, my personal experiences have seen people come from, the remote areas to the city areas to beg. So my idea has been to provide kits and food to them in their areas so that, just to create a difference in whatever way I can. Am I audible?
Yes, yes, I can hear you, and I can also see you. You are very well protected, wearing your mask and
Yes,
also a
so
face
we
shield.
have a van right
I
there.
believe you
So
are
we were
right now in one
on
of
our
those
way.
locations where you are distributing food items.
No, we have just started out. So we have got the van right there. I'll just show you. There's the van. And we were going to start. And, we'll right now move towards Kannur and, we'll be going to the slums and distributing the food there.
Yes, so you are catering to the slum areas. You are an entrepreneur in your real life, in the sense that is what you do for a living,
Yeah,
and
that is
now
true.
you're using those funds. Did I get you right in that? That it's not you've just
Yes,
started
yes,
a
yes.
week ago.
Absolutely.
So what inspired you to
Yes,
start on this
absolutely.
mission, and how do you generate funds? Is it entirely your own money?
About the funds, it's completely self-funded for now, so we don't have like a lot of collaborators. And me, my family, my team, we have been doing something at an individual level. And about the inspiration, there is, I have been doing all of this always at whatever level possible. Yeah, but since our whole family was infected with COVID like a few weeks back, like not a few weeks, has been almost a month. So
Okay.
we were hospitalized and we did see something, you know, first-hand experiences, and it really helps put things into perspective, and you get some more empathy for the people out there, and help was required. And since I was privileged enough, I decided that okay, it's time to step up and do something right.
Absolutely, and that this is interesting. You're saying that you, your family, your teammates, everyone got infected,
Yes,
and
yes,
after
yes.
you recover, the first thing you
Yeah.
decide to do is help those others who might be
We
in a
we
similar
were planning
situation, and that is the
we
kind of
were
spirit we
planning
need,
about all of
Ashish.
this.
Yes,
Thank you so much. We were planning about all of this while we were in that recovery phase, but as soon as we got recovered, of course, we started it, and we hope to continue it to the best of our capacity, till we last.
absolutely. We wish you all the best for that. I will talk to you more
Thank you so
about
much.
what you gather when you
Yes.
go into these slum areas, because there are a lot of reports that we have today from in and around Bengaluru about rural health infrastructure. But before I come to you for that, coming back to you, Hyder Ali, at the moment, what we are talking about also is how many professionals who do have a full-time job, who actually are professionals in their own right, are trying to take out time for this. So many of us, we use this excuse that we are already so swamped with work, we have a job to do. Where is the time to do anything extra? So how would you answer that question? How do you get this time, this extra energy? Where does it come from?
Yeah. Actually, this is a lockdown period. So this is a lockdown period. We are having only that online classes. So now that is the study holidays for our
Okay.
college. So meantime, we have a lot of time. Actually, this is not new to our team.
Okay.
We are working from the Chennai floods and even the Kajaf cyclone, even the Kerala flood. A team of members in our college, any calamity, any disaster, be the force, we will come out of the college and serve the needy people with the face to face, issue what are the items they needed, whether it is a Tamil Nadu or Kerala, or in Tamil Nadu there are the Vedaranyam, Point Kalimar, wherever the food record, what are the things the poor needy people need, go directly to hand over the materials to the needy people. So this is not the need to us. And even the pandemic situation, our staff, our management, we decided to give food to the needy people, because all there is no hotel, there is no tea shop, No, nothing is in the Rayapeta area. So we planned, our management, our staffs, our relatives, our students, alumni, altogether we joined. Initially started with the 15 packets. Now today at 11 o'clock and 11:20 we will finish it off, file it off within 20 or 30 minutes with the help of our Rayapeta police, and we distributed 1,000 food packets to the laymen or the frontline workers, because there is no job at all. The job there is no in the market. What they are going to do for this lockdown period? Definitely, we have to help the poor. They are our brothers. They are their sisters. We are having the ladies separate queue with SOP followed by the Tamil Nadu government, the central government, WHO. We wore that PPE kit with the gloves, face shield, everything. And that we have to give the mask to the needy people when they are wear that PPE kit or the box, then only we will issue the food to the needy people. And today we issue that arsenic album, the tablet, and even the what you call the kasayam, that is habachur kudineer. That also we issued that people for their boosting the immunity.
Right. So this is what I mean when I said that these kind of community partnerships, civil society groups are coming together. This college, the new college, the staff, the students, the alumni, the trust members, they've all put their heads together and decided that as a family, we can do something. We can step up. And like Mr. Hyder Ali so beautifully says, that they are our brothers and sisters. If we don't look after them, who will? So how can you be looking the other way when there is suffering around you? Hyder Ali ji, you were also telling me that when you set out to distribute food, you see people queuing up since early hours. It must be so moving for you to see that there are people who are queuing up for food packets today because they have fallen out of jobs. What is it like? I mean, when you reach there, what do you see and how do people react? What is the response you are getting?
Yeah. Actually, these people, they stand 8:30 in the morning in a queue, and once you will enter in that place, they will wish every volunteers. They are saluters, because nobody is using the food. By God's grace, you are getting the food from the new college, and they are appreciating our institution, and also thank to the management, thank to the volunteers, thank to the society, our college principals, vice versa, everyone. And every day we are giving the immune booster, then only we are receiving the packets to the needy people. And what I'm telling is, now the Tamil Nadu government, the new government, gradually it is coming down, the declining stage in our Tamil Nadu. 7,500 now. Yesterday, the only 1,600 COVID patient reported. So gradually it is coming down. But still the poor, the needy people are standing in the morning 8 o'clock in front of our college gates. Gradually, I hope in the forthcoming days, gradually it will come down to get the food packets from our college, because that the lockdown is last the lockdown happened to our Tamil Nadu. Definitely, these people, they will move to the jobs and other works. Definitely, I will tell you, I can tell you.
So that is the
So
cushioning you are providing, Hyder Ali. That is what you are doing as your service to humanity, that during this lockdown period, people who are out of their jobs, who cannot make a living, you are catering to them. And of course, we see those long queues. People are waiting for the new college of Chennai, the staff to show up with the food packets, and we can see the long queues of people there waiting for the food packets. That just goes to show how many people are out there wanting 2 meals a day. That's the level of desperation that is there on ground, and not waiting for the center or the state to do their bit. These are organizations that are stepping up. Ashish, you also go into slum areas, you see the poorest of the poor. Now, we're running a report today, in fact, about how in Bengaluru and in rural parts of Karnataka, there is very poor health facilities, and there isn't much awareness about following COVID protocols. So people must be extremely vulnerable. What have you observed in your trips to these slum areas?
That is very true. See, so we went to this place on Saturday. And as I told you, we had like around 60 to 70 like houses there, and it was like a community. All the kids, the parents, everyone, they were on the streets, and I was really surprised. Most of them were without masks. Like most, and by most, I'd say like around 90% maybe. So rarely I saw someone who was wearing a mask, and even if someone was, it was like it looked dirty, and it was below the nose. Of course, that's not really good. So I think, yeah, it might be lack of awareness, but right now everyone knows what Corona is. Has been like this is the second year. So I think maybe lack of resources is one thing that I can maybe think about. And we are doing something about it. I've already ordered the mask kits. So we
Lack of
aim to
resources.
provide those kits as well. Yeah, that has to be the case, because see, everyone knows how COVID is spreading, and most of them should know. And this is not like completely outside that they are oblivious as to what is happening in the real world. It's in the city, but outside. So lack of resources is what I think might be the issue.
Because Ashish, the reason I asked you that question is we have data to suggest now, which we are reporting in our bulletins today, that the case fatality ratio in Bengaluru and in rural and urban Bengaluru is quite high, higher than the national average. Even though the number of active cases are coming down, the per day cases are coming down, the mortality is high, which means that people either do not detect the symptoms early, they do not get medical care early enough. And this is a virus that affects the respiratory system. Obviously, if it is not treated on time, it can aggravate. And that is the reason, perhaps, why such high death rate is there. Is there enough health care facility for the poor? Because you are catering to one aspect. I understand that, after all, people need their basics. They need their food and water. You're catering to that. But what about healthcare facilities? Do they have access to medical care in these areas?
Them, and to those people that I cater to, they did not receive any medical aid so far. So only individuals have been helping, individuals like me. So they have been receiving food, occasionally from other people.
Okay.
But healthcare, if you talk about, there has been nothing so far. They're not even vaccinated, so
Yes, so
it's
which is yes,
yeah,
that's
it's
why
really sad.
we've been raising this issue, that the least that the government can do, that start vaccinating people
That's
as
true. Has to be
quickly
the
as
case.
possible, covering as many people, because like you said, people are not going to be following COVID protocols. They cannot be in these slum areas wearing masks all the time. And if there is an outbreak, it is going to infect everyone in that area, given the congestion,
That is
given the
true.
fact that people are not used to following this kind of discipline, and to enforce it is equally difficult. Hyder Ali, is there any such concern around Chennai as well? Because like you said, the lockdown has been extended in both Karnataka and Tamil Nadu. In some other parts, the unlocking has started, but in Karnataka and in your state, the lockdown is going to carry on till 15th of June.
Yes, ma'am. This lockdown is extended up to 14th of this month, and we are helping up to 14th. Still, the
14th, sorry,
government
yes.
lockdown announced. Anyhow, that the day by day that COVID report is day by day it is declining, and we are having the very good infrastructures. Even all the hospitals, we are having the oxygen bed. Even the institutions, we are having the quarantine center, and now the patients that the what you call that mild infection, that is also it is narrowly it is come down.
Okay, but then the concerns remain that, there are areas where government aid is not accessible. There are individuals like Ashish Ranjan, individuals like Hyder Ali stepping up to help, because people are actually queuing up for their meals. Their daily wage earners, the daily laborers are hit the hardest. They have no work. There are no hotels and restaurants which have remained shut, and now with the lockdown extended again in these two states, individuals, civil society groups, and of course community partnerships are really helping out to make sure that no one goes hungry. And for that, we are grateful to individuals like you, Hyder Ali, and you, Ashish Ranjan. Thank you so much for joining
Thank
us
you.
on Inspire India. And truly, these are stories that must be heard, because these are individuals who have shown the way that if you do your bit, a small change often makes a big difference.